WAUSM utilizes the NBME exam starting in semester 1. Could you explain the rationale for our methods and how it helps students in learning?
For all of you out there, if you're not familiar with it, the NBME is the National Board of Medical Examiners, and they are the body that writes the STEP exam. So you will have to pass step 1, step 2, step 3. And so they're going to be writing these exams. So I think one of the most amazing things we did when we were developing our program here was we have the privilege, it really is a privilege, from the NBME to use their customized assessment service, which we call the CAS exam. And what WAUSM has the privilege to use is their question bank, and these are step 1 questions. So as Dr. Selfridge said, we might be cardiovascular unit. So at the end of the unit, the faculty will sit together and they're able to do what we call as blueprint an exam. And so we'll take questions from the actual NBME bank that we have the privilege of using and just create an exam. And what's awesome about that is it maps right to our learning objectives, and we can modify the difficulty of the exam. And so what's wonderful about this is from your very first exam at WAUSM, you're conquering and warming up to step 1 questions. They're all step 1 questions. So it eliminates this problem also of, questions being written by faculty and maybe not appropriate or there's errors in it. And that just happens in life. But now we can feel really good about students getting really, really familiar with step 1 questions from the very start. And that may sound very intimidating, but I think Evan and Ryan can say they're in 4th semester. By the time you get to 5th semester, you will have taken 16, not 1, not 2, not 4, 16 NBME exams. And that's powerful because by the time then you get to 5th and you have to take your comprehensive exam that prepares you for step 1, students are really, really good at this because practice makes perfect and all of this repetition. And I love that we're utilizing it here. And I think it's one of the greatest things that we've done.
Yeah, oftentimes it's semester 5 before a student starts into that level of detailed questions.
True.
I mean, it might start a bit in the second year. It's after their course week learning thing dive.
Yeah.
And so like Laura said, it's so much more, early.
And that's why it's really important, like we say, hashtag make it sticky or hashtag why should you care? Because we're going to map it directly to NBME. So we have to be teaching at an appropriate level that the students are going to be really able to really conquer, like I said, and perform really well on these step 1 questions. And as we know, most of them are integrated and they're all patient vignette and integrated. You're going to have to know your pharm related to your anatomy, related to your physiology and your pathophysiology. And that's why we teach in the way that we do, because that's going to help you for step 1 and it's going to help you in your clerkships when you're seeing patients. So I just love it. I love the way that we assess students. And I think it's just tremendously appropriate for your success, for their success.